Right now, without you even really thinking about it, your tongue is doing these crazy complex micro
Yeah,
movements.
just to keep you from choking on your own saliva, actually.
Right. It is constantly sweeping and blocking and, adjusting. But what happens if that main wire controlling all those acrobatics just gets cut?
Well, that's exactly what we're looking at today.
Welcome to today's deep dive. Our mission for you today is to completely rethink how you understand one of the most vital but honestly totally overlooked organs in your body.
It's something we really take for granted.
Absolutely. We are pulling from this really fascinating July 2026 position paper by Dr. Lev Nemotin from N5 Digital and Isotone. It's titled Feedback Guided Rehabilitation of Hypoglossal Nerve Dysfunction.
Right, and it really challenges practically everything we think we know about strength recovery and how our brains actually talk to our bodies.
Which is huge.
It is. I mean, it forces us to kind of abandon that deeply ingrained, no pain, no gain mentality.
Yeah. Right, because usually physical rehab follows a really linear equation, doesn't it?
Exactly. You tear a shoulder muscle, you rest it, you hit the gym. You lift 1 pound, then 2, then 5.
Like the body is just a machine that needs its engine revved a little harder to clear out the rust.
Yeah, but this paper looks at conditions where the nerve itself is damaged, whether that's from a stroke, some sort of injury, or even the delayed effects of cancer treatments.
And it shows that pushing harder doesn't just fail, it can actually be super dangerous.
It can cause real harm.
Okay, let's unpack this. We need to start by understanding the hardware here, right?
Yeah, we have to lay the groundwork.
So the paper focuses heavily on the hypoglossal nerve, which is also known as cranial nerve 12.
That's the main engine, basically, the principal motor nerve for the tongue.
Right. It controls protruding, retracting, moving side to side, and making all those tiny shape changes that allow you to speak and chew and swallow.
And when cranial nerve 12 dysfunctions, I mean, the real-world consequences are incredibly severe.
Like what? Exactly.
Well, we are talking about a tongue that deviates completely to one side, mostly because the healthy side just overpowers the damaged side.
Oh, wow. So it literally pulls it off center.
Exactly. And because of that, food gets pocketed in one cheek, speech becomes really slurred, and swallowing becomes terrifyingly inefficient.
Which sounds awful.
It is. It leaves this oral residue behind in the mouth and throat, which is a major, major choking hazard.
So the traditional clinical view, like the standard output-based approach, has always been, the nerve is weak, therefore the tongue is weak.
Yes, that's been the prevailing logic.
It's like traditional medicine is treating the tongue like a broken video game joystick.
That's a really good way to put it.
Right. Like if the wire connecting the joystick to the console is frayed, the character on the screen won't move properly. So therapists just tell the patient to mash the buttons harder, force the joystick.
Right, but if we connect this to the bigger picture, treating the tongue like a dumb joystick is a fundamental misunderstanding of the neurobiology. Well, the tongue is not this one-way street where the brain just barks commands and the muscle obeys. Think of it more like an orchestra.
Okay, an orchestra?
Yeah, the motor nerve cranial nerve 12 is the conductor, and the sensory nerves are the musicians playing the instrument.
Wow.
So if the conductor's baton is broken, yelling at the conductor to wave their arms harder isn't going to fix the music.
Because the musicians have to actually listen to each other to keep the rhythm going.
Precisely. I mean, the tongue is a closed-loop motor organ.
A closed loop, meaning it goes both ways.
Exactly. Even as it executes a movement, it is constantly generating and sending just massive amounts of sensory information back up to the brain. And it does this through completely different, perfectly intact nerves.
Oh, interesting. So it's not the frayed wire sending the signal back.
Nope. The tongue is feeling the shape of the teeth, the pressure against the palate, its actual position in space. So when the outgoing command wire is frayed, asking the patient to just push harder completely ignores the fact that the return wires, those sensory feedback loops, might still be perfectly intact and ready to help.
For you listening right now, try this. Press your tongue gently against the inside of your right cheek. Just feel that pressure for a second.
That right there, that is your sensory loop working perfectly.
Right. Now imagine if half of your tongue couldn't physically push, but you still somehow needed to swallow your lunch.
And this is exactly where Dr. Nemotin proposes this paradigm called feedback neurology.
Okay, what does that actually mean in practice?
Well, the goal here is absolutely not nerve regeneration. It is not some magical cure for the damaged conductor.
So we aren't fixing the frayed wire.
No, the goal is purely functional improvement. We're talking clearer articulation, safer swallowing, using those surviving sensory pathways to essentially map a detour in the brain.
That makes a lot of sense.
Yeah. And we achieve that detour by flooding that closed loop with specific, highly targeted feedback.
Like what kind of feedback?
Visual feedback, for one. Having the patient use a mirror to actively watch and correct the deviation of their tongue to center it.
Okay.
And tactile and pressure feedback, just like you just did. Having the patient press the tongue gently against the cheek or the palate to sense that right to left asymmetry.
Right, right.
And auditory feedback, too. Having them repeat very specific, sharp sounds like la, da, da, not, to gauge exactly when their precision starts to blur.
Okay, but wait, I have to push back here on behalf of the listener because
True.
practicing speech sounds in a mirror, pressing your tongue against your cheek. I mean, people have been doing these exact exercises in speech therapy for decades.
They absolutely have.
And the paper also mentions instrumental biofeedback tools endorsed by the American Speech Language Hearing Association, AAA.
Right, standard clinical tools.
Yeah, things like Surface EMG or the IOPI. The IOPI is basically this tiny air-filled balloon you press your tongue against to measure pressure, or SE's flexible endoscopic evaluation of swallowing, which is essentially this tiny camera on a thin tube that goes through the nose to watch your throat from the inside.
Right, which is widely used.
Exactly. None of these tools are brand new. So why is this paper framing this as some sort of new neurology breakthrough?
Well, what's fascinating here is that the innovation is not the invention of the mirror or the pressure balloon itself. The breakthrough is how they are being organized.
Organized how?
Historically, clinicians use tools like the IOPI to measure maximum strength, or they use mirrors to basically drill a patient to physical exhaustion.
Well, push harder thing again.
Exactly.
Yeah.
But Dr. Demoten's framework takes these existing tools and organizes them around a neurological model meant to map and train that remaining sensor-motor loop.
Oh, I see.
The clinician is no longer asking, can the patient push harder? They're asking, can the patient perceive, guide, and repeat a better movement?
So they are completely changing the therapeutic target from like maximum muscle strength to usable, sustainable neurological control.
That is exactly it. The brain uses that sensory map from the cheek or the mirror to basically bypass those frayed motor wires.
And recruit different healthy muscle fibers to get the job done.
Exactly. It is about the quality of the signal, not the volume.
And if the goal is the quality of the signal, that completely breaks the traditional rules of physical exercise.
Totally breaks them. You cannot train this delicate nerve system like a bicep.
So what does this all mean? It means we have to look at fatigue in a totally different way, right?
We really do.
The paper adapts principles that Dr. Demoten originally developed for low-load ALS rehabilitation, these systems called isotone light and micro.
Which is crucial context.
Yeah, and by the way, bulbar ALS is this devastating form of Lou Gehrig's disease that specifically attacks the motor neurons controlling the face, head, and neck first.
It's incredibly aggressive.
Right. So in this feedback neurology framework, fatigue is not viewed as a lack of motivation. It is not an inconvenience you conquer with a motivational poster in a gym.
No, absolutely not. It is treated as strict, non-negotiable information. It is a dosing signal.
A dosing signal.
Yeah, and this is perhaps the most critical safety concept in the entire paper. Fatigue is your body telling you that the neurological loop is totally maxed out.
Which in traditional exercise is a good thing, right? Pushing past fatigue is how you trigger muscle growth.
Sure, for a healthy bicep, but with a damaged cranial nerve, pushing past fatigue means the system just starts to fail.
And that's bad.
Very bad. Because when the hypoglossal system fails, the patient loses control of their airway.
Like, okay, think of it this way. If your smartphone battery is at 5%, you do not open up 10 graphics-heavy apps to train the battery to work harder.
No, you definitely don't.
You conserve it. You turn down the screen brightness, you close all your background apps because you still need that remaining 5% to navigate home safely.
That is the perfect way to look at it. The tongue needs its remaining battery just to swallow dinner without choking.
It's literally a matter of survival for that meal.
It really is. The golden rule established in this paper is that a therapy session should never, ever make the next meal, the next conversation, or the next day worse.
Wow.
If a patient does ton work in a clinic and then goes home and experiences delayed weakness, choking on their water, or they develop a wet, gurgly voice after eating, the dose was too high.
They burn through the battery.
Exactly.
You know that feeling when you swallow water down the wrong pipe and you're just coughing for 5 minutes?
It's awful.
Right. Imagine feeling that way after every single sip because your physical therapist made you do too many tongue presses. I mean, the therapy literally caused harm.
And that is the terrifying reality for a lot of these patients. Pushing a dysphagia patient, someone with swallowing difficulties to exhaustion, can actually cause oral residue to slip into the airway.
Leading to aspiration pneumonia.
Yes, that's a severe lung infection caused by inhaling food or liquid. It can literally be fatal.
Which is why the paper emphasizes that the best candidates for this approach are those with mild to moderate unilateral weakness.
Right, or patients with post-stroke incoordination, or very carefully screened patients with early bulbar ALS, where extreme caution is required.
Okay, so we've established how delicate and precise this feedback loop is. But the paper presents a specific case application that I just found absolutely mind-blowing.
It's a really powerful example.
It perfectly illustrates why standard therapy fails. We are looking at a head and neck cancer survivor here.
Yeah, and this is a scenario that is incredibly difficult for both patients and clinicians. The suffering here is profound.
So the patient profile is someone who had radiation therapy for neck cancer roughly 13 years ago. But the speech and swallowing symptoms, the slurring, the choking, only appeared 3 to 4 years ago.
Right.
That is a 9 to 10-year delay. They are diagnosed with late radiation-associated hypoglossal neuropathy and radiation fibrosis syndrome.
It's a mouthful, but it's a very specific pathology.
And the underlying causes isn't just that the tongue muscle got lazy. It is partial nerve injury, it is vascular compromise, and it is fibrosis.
Right, which is a severe progressive stiffening of all the tissues around the muscles.
Here's where it gets really interesting, because I'm kind of stuck on the timeline here. 13 years.
It sounds impossible, right?
Yeah. How does a radiation treatment someone had a decade ago suddenly start paralyzing their tongue today? That just doesn't make physiological sense to me.
I get that.
And on top of that, how exactly does feedback help a tongue that is physically trapped inside fibrotic scar tissue?
Well, this raises an important question, and it really highlights the insidious nature of late radiation effects.
Okay, explain that.
When you receive radiation to the neck, it damages the DNA of the cancer cells, sure, but it also causes microscopic damage to the healthy blood vessels and connective tissues.
Ah, collateral damage.
Exactly. And over years, sometimes a decade or more, like you said, that tissue slowly loses its blood supply, becomes rigid, woody, and fibrotic.
Wow.
The nerve itself might be directly damaged, or it might just be slowly compressed and starved of oxygen by this tightening, suffocating scar tissue.
So 10 years later, the patient starts choking on their food.
Precise.
And routine speech therapy for this just feels completely inadequate to the patient. It's totally generic.
Because it's treating the wrong problem.
Right. It addresses the visible symptom, the weak tongue, and basically tells the patient to push harder. But you cannot push your way through a fibrotic neck.
No, you really can't.
It's like trying to flex a bicep while wearing a straitjacket made of thick, hardened rubber.
That's exactly what it feels like.
The more you fight it, the more exhausted you get, the more your battery drains, and the worse your swallowing becomes.
And feedback neurology doesn't cure the straitjacket. That is the crucial distinction to understand here.
Right, it doesn't magically dissolve the fibrosis.
No. What it does is give the patient a targeted strategy to find what the paper calls their functional window.
Their functional window.
Using mirrors, pressure sensors, and those auditory cues, the clinician helps the patient map out exactly what tiny amount of activity still works.
So maybe they can't push hard, but maybe they can sense just enough pressure to move a smaller bite of food safely.
Exactly. They learn better pacing. They use feedback to optimize the exact limited control they have left without provoking that dangerous fatigue in a stiff, damaged environment.
It's working smarter within the straitjacket rather than fighting it.
Exactly right.
But, because conditions like late-stage radiation neuropathy are so
Yeah.
frustrating, and because conventional medicine essentially says, we can't cure this, we can only help you manage it.
Patients understandably go looking for miracles.
Exactly. The paper takes a very hard look at the controversial landscape of experimental therapies and regenerative medicine.
Because when you tell someone they are slowly losing their ability to eat or speak, desperation sets in immediately.
Naturally.
They want to fix. And there is a booming industry out there ready to sell them one.
And the paper specifically issues a strong warning against relying on experimental treatments outside of regulated clinical trials.
Yes, very strong warnings.
We are talking about stem cell injections, exosomes, stromal vascular fraction, which is basically a soup of cells extracted from fat tissue, or Wharton's jelly injections.
Which is a gelatinous substance taken from umbilical cords.
Right. And clinics offer these injections promising to magically regenerate tissue. But the paper states flat out that targeted injections along the hypoglossal nerve are not an established treatment for radiation-associated neuropathy.
No, they are not.
And it cites the FDA, noting that regenerative medicine therapies are not approved to treat neurological disorders.
The FDA is very clear on this.
But look, I want to play devil's advocate for the desperate patient here for a second.
Okay, go ahead.
If conventional medicine is basically shrugging its shoulders and saying, we can't cure this, why shouldn't a patient go to a commercial clinic, spend the money, and try Wharton's jelly or stem cells? I mean, what do they really have to lose?
I mean, it is a completely valid emotional response.
Yeah.
If you're drowning, you will grab at any life preserver,
Yeah.
even if it looks totally deflated. But the objective medical reality outlined in this paper is that they have a massive amount to lose, specifically their airway.
So because of the exact location where these injections happen.
Yes. Think about the anatomy we just discussed. You are dealing with an area of the neck that is already heavily fibrotic, highly delicate, and suffering from vascular compromise.
Meaning very poor blood flow.
Exactly. And most importantly, this area is responsible for protecting the windpipe during every single swallow.
Right, right.
So injecting unproven biologically active substances into that specific damaged environment carries massive risks. It could trigger an inflammatory response that swells the tissue.
Oh, wow.
It could cause structural obstruction. You could take a patient who is struggling to swallow but managing and suddenly render them completely unable to protect their airway.
Making the dysphagia permanently worse.
Yes. Now, the paper is not saying stem cell research is invalid. Far from it.
Sure.
It explicitly acknowledges that regenerative medicine, cellular products, and antifibrotic strategies are legitimate and vital areas of scientific research.
But that research belongs in rigorous, heavily regulated clinical trials.
Exactly. With oncologists, neurologists, and swallowing safety experts in the room constantly monitoring the airway. It does not belong in a commercial clinic promising a quick fix.
It's just too dangerous.
True. Lasting hope for these patients lies in intelligent, scientifically sound rehabilitation, mapping that closed loop and maximizing function safely, not in commercial shortcuts that bypass safety protocols.
Because it all comes back to respecting the complexity of the system. You can't just forcefully inject a magical solution, just like you can't just forcefully push the broken joystick.
Exactly. You have to work with the biology that is actually in front of you.
You have to listen to the body instead of just shouting commands at it.
That is the whole point.
So bringing this all together, what is the core message you really need to take away from this deep dive into Dr. Nemoten's position paper?
Well, I'd say the path to improvement for a damaged hypoglossal nerve and a failing tongue is less force, better feedback.
Yeah. Success in this realm is not measured by a perfect X-ray or normalized anatomy or a magical cure. Success is measured by real-world dignity.
Absolutely.
It is the ability to finish a meal safely with your family. It is having a clear conversation without losing your voice halfway through.
It is understanding your own physical limits and playing your neurological battery smartly.
And it highlights this massive shift in how we need to view rehabilitation across the board, honestly. We spend so much time focusing on the motor output, what the brain is telling the body to do.
Right. But this paper proves that the sensory input, what the body is telling the brain, is just as powerful, if not more so, when the system is actually compromised.
So whether you are prepping for a medical career, navigating the healthcare system for aging parents, or if you are just endlessly fascinated by the incredible resilience of the human body, this paper is a total revelation.
It really is.
It proves that sometimes the smartest way to fix a broken system isn't to yell at it to work harder. The smartest way is simply to listen to the feedback it is already giving you.
It's a profound lesson in neurological humility, really.
Which leaves us with a final thought to mull over. You know, we started by talking about that expectation of precision in medicine, the broken bone, the clear X-ray, the straightforward rehab of just lifting heavier weights.
Right.
But we've seen today that the nervous system doesn't really play by those rules. It is muddy, it is complex, but it is also brilliantly adaptable, provided it gets the right information.
Exactly.
So if our brains are plastic enough to bypass a damaged cranial nerve and regain control of a paralyzed tongue using nothing more than the sensation of a gentle cheek press or the visual feedback from a bathroom mirror, Well, what other loss causes in our bodies or even in our daily lives are just waiting for the right kind of gentle feedback to finally come back online.